A recent study by Stanford researchers found that AI chatbot ChatGPT scored a 90% in diagnosing illnesses, compared to just 74% for human doctors, who did not have access to the chatbot. And in a second test on decision-making in clinical situations, the AI chatbot outperformed doctors who only relied on traditional sources, and scored the same as doctors who used ChatGPT for assistance.
It's gaining access to immense amount of information and collating it in record speeds.
We wondered how potential patients feel about the increasing use of AI in medical care.
I think that AI is a useful tool to help supplement or even at times replace.
I think the answer you're going to get from most people, including myself, is that they would not be comfortable handing the reins completely to AI. You still need humans involved. You still need somebody holding your hand.
Sana, a pre-med student, tells us that at her university, there's constant discussion about the effectiveness of using AI in medicine.
I don't think it'll entirely replace doctors' jobs because there's empathy and there's a lot of compassion that goes into being a doctor and working with patients.
Baharan, who had heart surgery a decade ago, hopes we're still a long way away from AI outright replacing doctors.
If I have to have a heart surgery again, I am not going to be thrilled if the surgery is basically driven by AI. I want a skilled doctor who uses AI as a part of the procedure and diagnosis.
The CEO of Atropos Health agrees that AI is surpassing human ability in many diagnostic tasks, such as examining blood slides and skin problems.
Increasingly, I think, AI for skin lesions is a useful first line, but the knock-on effect of that is that more people will be diagnosed. That means there has to be more dermatologists to actually see and evaluate that patient, ultimately making treatment recommendations.
Hyde's company has developed ChatRWD, a generative AI chat interface that can answer medical questions and even produce new studies by tapping into historical data. In this example, ChatRWD is being used to find out what drug is more effective for weight loss for a diabetic with liver disease.
If a doctor has high-quality evidence in front of them, they know what to do, right? But what's happening most of the time is there is no evidence. There's just not a study a lot of times. We take that input of text, convert it through a chat experience into a study, run it on a patient-level data set, and produce a new study with new statistics, new analysis on tens of thousands of people that look like that patient, and give that back to the doctor.
How those AI-produced studies are integrated into care is also extremely important. Hyde says the aim is to have a doctor visit with a patient, have notes generated automatically, and then have those AI-produced studies appear almost instantly within those notes to better inform the doctor. So it's a vision of an AI-driven future, but one where the doctor ultimately makes the decision. Mark New, CGTN, San Francisco.